But I think one day women are going to be very angry at the fact that they were not given all the information. There's many organizations now that are opening up, women coming forward and speaking about their personal abortion story. And a lot of it is anger that they weren't given the whole truth when they made that decision as a teenager.
And the decision has to be informed, which means that there's a whole range of information that the doctor has to give the patient, both about the treatment or the intervention that they're thinking of having, all of its alternatives, and the alternative of doing nothing, plus all of the benefits, potential benefits, risks and harms of all of the possibilities.
You know, you get more information when you get your appendix removed than you do from having an abortion.
I was never informed about the truth about fetal development. I was never informed about all the risk factors of abortion.
I had more information given to me about my wisdom tooth taken out.
I said, what is abortion like? And he said, well, it's just like pulling a tooth out. Well, I've had a few teeth pulled out in my life and a little bit of pain, and after that it goes away. I never connected that I was pregnant with a baby. And most women don't who have abortions.
Again, when I went to the gynecologist, basically the doctor had given me the weekend to decide whether I wanted to have the abortion or not. And like I said, I was really confused. He just wasn't talking to me about things.
It appears that women are being asked to make a lifelong decision under time pressure, peer pressure, parental pressure, and without sufficient information.
On my way out the door of the doctor's office, I saw a poster on the wall of the development, of a child. And when I went to step in to look at that, he actually stepped in front of me and said, "You don't want to look at that. That's just going to make your decision harder." And that was what I left with. That's basically all the information that I had before I left to make my decision.
I was lied to and I was deceived. The second time I found out that I was pregnant, I asked the doctor what was developed, like what's really there. And he took a pen and a piece of paper and he put a dot in the page and he says, "Oh, it's nothing, it's just a clump of tissue." Mm-hmm. So I thought, oh, well, it must be okay if the doctor thinks it's okay and the government thinks it's okay and my mother thought it was okay. I thought it must be all right. And then years later, when I was reading a book on pregnancy and childbirth, and I saw the truth about fetal development, it was devastating.
They fear that they might not be able to get pregnant again.
However, abortion does not interfere with your future fertility.
So, for example, if let's say that there was no mention of risk of infertility to a woman having an abortion, and in fact the abortion did cause her to become infertile, then she would be able to sue for damages for that, because she wouldn't have given her fully informed consent to having that abortion when she didn't know of that risk. Because, come back to the test, would that be a risk that would be material to the reasonable woman in the same circumstances? And clearly the answer would be yes. That would be a very important risk to know about.
I was very angry. I had tried for 5 years to get pregnant and nothing happened. Angry that I wasn't informed, because when I look back at both abortions, there was no real, this is what you're going through, this is the gestation period, this is how pregnant you are, this is what it looks like. Even if you want to call it fetus, this is what the fetus looks like, this is the development, these are some of the potential consequences.
Well, nobody told me that after the abortion I would hate myself and that I would act out my self-hatred and promiscuity, and that promiscuity would lead me to contract a sexually transmitted disease.
Then the doctor's got a legal obligation and also an ethical obligation to disclose that information to the patient before they make their decision. So as we get new information, whether it's about abortion or a cancer treatment or cosmetic surgery or whatever it is, that has to be disclosed. Otherwise, the patient's decision whether to have or not have the treatment is not an informed decision, which means it's legally invalid, which means that that's an instance of medical malpractice on the part of the doctor, because the doctor is guilty of malpractice if they don't get a proper informed consent.
But the fact is, certainly as far as induced abortion is concerned, as I said before, I don't think these women have any kind of informed consent. And of course that's because the obstetricians or people doing it don't believe the literature that we've reviewed.
Prior to undergoing her procedure, she is asked to sign a consent form. Now, a document that intends to inform is written in understandable language. It's a typical medical consent form written so that a teenager under extreme pressure can understand it? Or is it written in legalese, designed to put the patient in a fog while protecting the medical community?
The other problem with written consent is that sometimes what doctors do is simply hand over the form and say, read this. And two things. First of all, there have been lots of studies done on the language that's used in consent forms, and it's really impenetrable. I mean, there's a scale called a fog index of how difficult something is to read and understand. And true romance is written at a fog index of 4.
So that is what a consent form should be written at. Instead, they are written at a level 23. Even worse than legalese.
Time magazine is written at a fog index of 12, which is considered reasonably comprehensible by somebody who's graduated from high school. Legal contracts are written at a fog index of about 22, and the consent forms that were looked at in this study were at a fog index of 23. So consent forms are not in themselves the answer.
I think there are 20 states now have what they call right-to-know laws. And these laws say that the woman must be told this and this and that before their abortion. And Louisiana has an amazing, I've seen their thing, it's a series of pictures of developing unborn babies, and then it's a list of complications. And they are supposed to read this before they have their abortion.
But no one really told me anything about fetal development. No one said anything, even mentioned a baby, just basically that the procedure was easy.
The courts say that the doctors must ensure the patient's full comprehension of the risks, not just have them sign something.
And also, if you look at the medical malpractice cases where there's been a finding of a failure to obtain informed consent, in one of them, for example, there was a signed consent form that had every possible risk explained in it, and the court looked at it and said, well, there's a signed consent form, fine, we're aware of that, now let's see if they really did get informed consent. So signing a consent form is not the giving of informed consent.
Nobody talked to me, specifically the doctor didn't talk to me about what it really meant to be pregnant. And the only thing I knew is that I was scared and confused.
So if a reasonable patient would want to know about that, the doctor's got a legal obligation to disclose it. Plus, the doctor has to fully, openly and honestly answer any questions that the patient asks. So you can't just pat the patient on the head and say, don't you worry about it, everything will be all right. If you do that, and in actual fact you should have told them something else, then you haven't got an informed consent, and then you're going to be liable, medical malpractice liability, for failing to get an informed consent.
And I said, they needed to give you a consent to sign. Did you sign a consent form saying that you consented to having your abortion? She said, yes. And I said, well, attached to that should have been a list of problems that you could have got into. Did you read it? She said, sure, I read it, but I didn't understand any of it. And then I said, well, and she said, well, I asked the nurse what all those words meant, because I didn't even know how to pronounce half of them. And she said that I didn't need to know what the problems were after abortions. Abortions were simply a benign procedure, and I was here to have an abortion because I didn't want my baby. And that's right, so let's get on with it.
People who have had abortions 10 years ago and people who've had abortions 2 years ago or even a year ago still say they weren't educated. There's not enough information that's been given to them to have properly made their decision.
It's up to the doctor to also make sure that the decision is voluntary and free from outside pressure.
You also have to watch the coercion, undue influence, duress, which goes to the element of the consent called voluntariness. So that, you know, it should be a situation in which the patient feels free to take any of the options. I mean, occasionally you do hear from women who've had abortions that they felt pressured to go ahead with it when they were sort of feeling that they weren't any longer sure that they wanted to go ahead with it.
I really felt pressured in both situations, partly being pregnant and emotional and not having any support from the man that I was focusing on.
I was so upset at that point and, you know, so distraught. And when a consent form is kind of shoved in front of you, the nurse is standing there and saying, sign this. You don't really take the time to read it. I know it was about a paragraph long, and I have no idea what it said.
I went to the hospital, and when I arrived at the hospital, actually for the first time, I realized that I had life growing inside of me, and actually decided that I wanted to be a mom. And going through that process, basically I went to the pre-op room.
A lot of anger towards my parents for pushing me to that decision of abortion.
I had a friend with me. She was my support, I guess. And I told her that I wanted to keep my child, and she went to get a nurse. But instead of listening to the choice that I was making, that I was actually changing my mind, they just gave me sedatives and proceeded to, you know, prepare to have the surgery.
Agreeing to an abortion is like making a business contract. Businesses do not like you trying to back out of a contract. They have bills to pay, so things can get very nasty. The courts have said a surgeon should try to stop the procedure if a patient asks.
And I remember, you know, crying and begging the abortion doctor to stop it, but he wouldn't.
When I was in the surgery room, I actually started to come to and tried to tell him again that I changed my mind. And basically, they put the gas mask over me, and I started to move about just to try and move my head to get away so that I could actually say something. And basically, they did finally move it away.
So I too, at that moment, thought, I need to stop this. My abortion isn't happening until tomorrow morning. It was the wee hours of the morning, probably 2, 3, and I got out of bed and started looking for my clothes, but they had taken my clothes off of the ward because, or at least out of the room, because they'd had experiences, I'm sure, in the past of women changing their minds, and they didn't want that to happen.
And I was trying to think of something that I could say that was quick enough that would get them to stop, because I just didn't want to go further with the abortion. So I asked for a priest, because I saw all over the hospital that there was signs, you know, that you have the right to ask for a clergy member or whatever. So I asked for a priest, and they just put the gas mask back over and turned it up. And
so they heavily sedated me. Basically, 2 big nurses came and planted me back in the bed, told me it was too late to change my mind, that the laminara had already been inserted and the abortion was underway. And I feel that I was forced to go through with the abortion in the morning.
There is a Supreme Court of Canada case that didn't involve an abortion. It involved a woman having a cardiac angiogram to look at the arteries in her heart, and they got into the procedure, and she changed her mind and said she didn't want to go ahead with it, and the doctors convinced her. They said, oh no, you'll be fine, and in fact she wasn't fine. She then had a stroke, and the court said that what they said was that if it had been possible to stop, then the doctor would have had to have stopped.
just before I went out, I heard someone say that, you know, cold feet or something like that. And then I woke up out of the abortion and generally waking up out of anesthetic, I scream, so, or yell out the first thing that I'm thinking. And basically, I woke up out of the anesthetic crying out the same thing I was crying out inside, and that was, I just want to be a mom. And that was the procedure.
Being pregnant and frightened means that thousands of women are saying yes to a procedure that they were not fully informed about.
Hundreds of thousands of other women have had emotional problems or physical complications after an abortion. And if they connect with them, they can start feeling like they're not, from Mars, that, wow, you had that feeling. It's amazing when I share my story, how many women will come forward and go, I had an abortion 50 years ago, or 40 years ago, or 30 years ago. I've never told a soul. I thought I was the only one having these feelings.
I know that there is a multitude, thousands and thousands of women across this nation who are suffering in silence and in pain because of the trauma that abortion has brought them emotionally. Like, it even affects your sex life, because now abortion is connected to sex, and so it can come into their marriage relationship.
I've been listening to women's stories since 1991, and some men, and I would say that's the predominant sense, is that there isn't another choice. And I would say that most women don't want an abortion. They want to be heard, they want to be loved, they want to be met, they want support in their crisis.
I think that it's imperative that women who've had abortions in the past 5 to 10 years have the courage, and it will take courage, to stand up and say, I was not, there was no informed consent. There was no freedom of choice because the choices weren't presented to me. And now I'm suffering from, repeated miscarriages or ectopic pregnancies or any of the, I believe there's somewhere around 30 physical complications.
Now, this is only my personal story, is what I encountered in counseling. Never had one woman come back to me and say, you know what, I really wish I'd had an abortion. Every one of them were happy with their choices of either adoption, the two that gave the babies up for adoption, and the other ones keeping their babies. They were happy they made that choice. But I tell you, it would be thousands of women who've had abortions that have said to me in my office or on the road when I'm traveling, I regret my choice to have an abortion. I regret it.
100%. There's not one woman that I've talked to that has said, yeah, I knew everything. I knew all the facts. I knew all the side effects and, all the trauma that I would go through afterwards. I don't know one that has been properly educated, because there'd be a lot of us who would be mothers today if we were.